In this pelvic floor strengthening video, we're going to cover some of the best exercises that we're not doing in the current workout program. The good news is that you've already been strengthening your pelvic floor muscles by doing lots of the exercises that we already do, like squats, the deadlift, the glute bridge, the bird dog. These are exercises which already form part of our workout program. In this video, we're going to show some ones which are more specific, more direct in terms of targeting the pelvic floor muscles. So firstly, let's talk about where the pelvic floor muscles are and what are the benefits from strengthening this area. So you'll see in this image here that the pelvic floor muscles are just at the bottom here underneath your bladder, your bowel, and your spine. And that is the area that we want to focus on when doing these exercises. So you might have heard me talk about the mind-muscle connection when we're doing our other workouts and our other exercises, but it's even more important when hitting the pelvic floor muscles, because let's say you're doing squats, you know you're hitting your legs, you're going to feel it in your legs when you're doing the exercise. So the mind-muscle connection, it's easy to focus on the area that you're working out when doing squats. But for the pelvic floor muscles, when you're beginning, it's difficult to find the area. So we'll start in the first exercise by teaching you how to find the area. So that's coming up shortly. And just to talk about the benefits of strengthening the pelvic floor. So most of the time with females, when they want to focus on strengthening it, it's so that they can improve bladder and bowel control. We would hear from people lots of times that they feel leakage when they're doing some types of training, especially that kind of high impact training that someone might do, running, maybe jumping jacks, HIIT style workouts. People can sometimes notice that they are unable to control their bladder as effectively as they should be. And one of the other main reasons is to reduce the risk of pelvic organ prolapse. So that's that feeling of heaviness, also described as a pulling discomfort in the pelvic area when the muscles and tissues can no longer support these organs seen in the image here, which causes them to then drop, which can lead to incontinence then, which also relates to the other reason why it's important to focus on strengthening this area. For now, using this image, it's going to be really important to notice and take note of where that pelvic floor muscle is, because this is what we want to concentrate on when we're going to be going through the following movements. Anne Lane very kindly put her name forward, among others, to appear in these videos, and it's doing an absolutely fantastic job with her program. So delighted to have her in these videos. So you can pass on your thanks to Anne. So this first exercise is a Kegel type exercise, and as I mentioned, we're going to do this in the beginning because we want you to get that mind muscle connection so that you're able to feel the area that we're going to be strengthening in the coming exercises. So starting off with this exercise, it's not going to look like Anne is doing much here, but this is the basic movement. So grab a chair, sit down, keep your back straight, put your hands on your knees. Now first, we want to identify the right muscles. So the easiest way to do this is to squeeze through the pelvic area as if you were stopping urinating. Those muscles that you're tightening are your pelvic floor muscles. So performing this exercise is very simple. Contract those muscles, so squeeze and hold them for 5 seconds, and then release for 5 seconds, and then squeeze again, holding it for 5 seconds, and then release again. And do that 10 times. This is something that you can actually do throughout the day. It's recommended that you could do this 3 times a day. You do that for 10 times, and then you do that 3 times a day. In time, you can also build up to doing it 15 times and doing it 20 times, 3 times a day. So in this next video, we're doing the lying pelvic floor tilt. And again, you're not going to see massive movement because we're using those small inner muscles of the pelvic area. If you're someone who finds it difficult to get up and down off the floor, then you could do the standing or the seated exercises first and then move on to the exercises where you're on the floor. Now you could also use a bed for these lying down ones. So some important advice in around this exercise. So don't see it as a glute bridge. Do not push from your legs and push your glutes upwards. We're not focusing on that. If you start feeling this exercise in your legs, it means you're doing it wrong. Again, we want the mind muscle connection, and we want you focused on those pelvic floor muscles. So what we want to do is tilt the pelvic area back towards your head. Now, what you could do starting out is, as you're lying on your back, put your hands under the small of your back, and you'll feel that there's a bit of a space just to fit your hands in. Now, with this movement, when you're tilting your pelvic backwards, you'll be flattening your back into the floor. So that's the kind of movement that you're going for. It's like as if you're sucking your belly button inwards, and therefore your back is now touching the floor. That would be when you're performing one repetition of the movement. So again, when you perform the repetition, hold it for about 5 seconds, and you can do that 5 to 10 times. Now, if you're brand new to these pelvic floor exercises, you don't want to do all these exercises on day one. So then you're doing multiple high repetitions of pelvic floor exercises. To begin with, just pick even one movement and do your 10 repetitions of it. And then the next day you can work in one of the other movements. You'll see here in the video, Anne is also doing them at angles. What you can do is perform 3 repetitions where you're tilting your pelvis straight back towards your head, and then perform another 3 where you're going up at a 45-degree angle to the right, and another 3 going up at a 45-degree angle to your left. So in other words, you're hitting the muscles from different angles, and that's always a good technique with all different types of exercises that we do. In this next video, we're doing standing pelvic floor tilts. So it's a very similar movement pattern which your pelvis is going through, but we're doing it in a standing position. So for this exercise, bend your knees, keep your back nice and flat. That's going to be important. You do not want to have a rounded back. So keep the back flat, just like we do with our other movements. Cross your fingers together and put your hand just above your knees in between your thighs. You can then work on squeezing your thighs together, really pinning your hands in place. And then it's a very similar movement pattern. So with this, exhale and lift your pelvic floor. So again, you're rotating that pelvis upwards and acting as if you're pulling in your stomach and that pelvic muscle area as you're tucking your pelvis in underneath. As you're doing this, you will in fact round the back as you're pulling your belly button in towards your spine. Your back is rounding, and then inhale and go back to the starting position. Again, hold it for 5 seconds, release for 5 seconds, and do this 5 to 10 times. So this next movement is going to be a bit different in the way that we're not tilting our pelvis. We're more focused on squeezing our feet together and squeezing our knees together. So sit down in this position, have the pillow between your knees, and then lean back. So this is the important part. It's similar to the Russian twist movement we use, which also will help strengthen your pelvic floor. So you're leaning back, but you're keeping your back flat. So that's important. Shoulders are back, your chest is raised, that kind of position where you're keeping the back flat. So basically you're not leaning back using like the middle and lower area of your back. That would result in a rounded back. Instead, you're keeping good posture, so your shoulders are pulled back while you're leaning backwards. Now in this movement, you want to squeeze your feet together really hard and squeeze your knees together. So you're squeezing the pillow. So pretend someone's trying to rip the pillow out from between your legs, but you're holding it in place. You're going to feel it in your deep abdominal muscles, your pelvic floor. So again, a fantastic movement. Hold it for 5 seconds and then release for 5 seconds. Hold it again and release, and do that up to 10 times. This next exercise is called the split tabletop. It's one of the more difficult ones, but we'll also show an easier version in a minute. So in this movement, you lie flat on your back. If you could use an exercise mat, it'll make it easier if it's a hard floor. What you want to do is get into this position where your calves are parallel to the floor, your thighs are perpendicular to the floor. Now it's going to be really important to keep your feet in this position throughout the movement. What you then do is you open your legs. Now when you're opening your legs outwards, you don't want to start by moving the feet and then following with the knees or vice versa. You want to move your knees and your feet at the same time as you're opening up the groin, and then hold and back to the starting position again. It can be difficult to hold this one. If you can hold it for a couple of seconds when your feet are in the outward position, but if you're not able to do that, then keep doing it in repetitions where you move outwards and back together again. Now this is a really great actually core movement, so it's working a lot of muscles within your core. So brace your abs and brace your thighs. You want to activate them throughout the whole movement so that you can stay strong throughout the movement. If you find that movement too difficult to perform, then this is the more basic version where you keep your feet flat on the floor, your knees are together, starting the movement, and then you would move one knee out to the side, back to the starting position, and then you go again, bringing one leg out and back, and then the opposite knee out and back. With this, it's again, you focus on that mind-muscle connection, focus on your pelvic floor area. If you're struggling to find it, go back to that first movement we did where you're sitting down, contracting those pelvic floor muscles. So those are some of the key movements to perform. Again, if you're new to exercise, focus on just one, do your 10 reps and maybe leave it like that for the day. The next day you could do 2 of the exercises for 10 reps each and work your way upwards from there. You don't need to perform all the exercises in this workout one after another. If you're more experienced, that is something that you could do, but you don't want to strain yourself and then not be able to do the workouts for a week or even 2 weeks if you overdo it in the beginning.